biggest way is to find out through blood or urine tests through your primary care physician. The most common blood test is something called a serum creatinine level. Though a creatinine level doesn't mean the same thing in every individual. And this is where we come up with that term GFR, or glomerular filtration rate, that your doctors may be talking about. We realize that because the creatinine levels are dependent on age and sex and your muscle mass and your body makeup, that sometimes people's kidney disease is being picked up very later on, and they're being referred to nephrologists a lot later on in life, when we could have had a greater impact in their care. The GFR gives us a rough estimation of your kidney function, and it gives your doctor a way of deciding when you need to see a kidney doctor or a nephrologist, when you need to be screened for different conditions that come along with kidney disease, such as anemia and bone disease and malnutrition and hypertension. And also it gives us a sense of when you need to be starting the preparation process for dialysis and transplantation. The biggest problem we've had in this country is people come to kidney doctors very late on, and we don't have the luxury of taking time to educate individuals and give them more options in terms of choices. Our goal for people going on to end-stage renal disease or where they need dialysis is to get them transplanted before, if we can. So GFR gives us a rough estimation of your kidney function. And what's the nice thing in this country is most labs in the country now will actually print out a GFR level when you get your blood tests. And that helps get your doctor to start the discussion with you about kidney disease, what you can do about slowing down the progression, and also get to a kidney doctor earlier on. So who needs to be screened for kidney disease? There are a lot of risk factors for kidney disease. Diabetes is the biggest one, and I really want to focus on that. 40% of individuals with diabetes develop kidney disease. More than 50% of every dialysis unit is made up of individuals who have diabetes. 40% of people who are starting to develop diabetes, who don't even have the official diagnosis, already have evidence of kidney disease. So diabetes is a huge impact. So if you have a family history of diabetes, if you have ever been told you have higher blood sugar, you need to have that discussion with your doctor about getting tested for kidney disease and starting that process. Hypertension is another significant cause of kidney disease, and it can be a very aggressive form. The difficulty with diabetes and high blood pressure, both of them, when you only have minor changes, you don't have a lot of symptoms. And it's very hard to get in the mindset that what you're doing to treat both the diabetes and hypertension will help prevent a lot of complications. The genetic causes of kidney disease, you really can't change. But if you have family history of kidney disease, if a lot of members of your family have had evidence of kidney disease or have had to have dialysis or have had to have transplantation, that's an important discussion you need to have with your doctor about getting screened early for kidney disease. There are other different causes of kidney disease as well. Sometimes it can be a complication of medication. So individuals with conditions such as rheumatoid arthritis, gout, severe osteoarthritis, things where they have to be on a lot of medications for a significant period of time are also at risk of kidney disease. The importance of realizing that you have kidney disease and the level of kidney disease that you have is that we can do things to help reduce the risk factors for progression of your kidney disease, such as control your diabetes, control your high blood pressure, weight control, controlling your cholesterol panel. All of those will help slow down the progression of kidney disease and help prevent major complications. In terms of what you and your doctor will work on, they take your GFR level and decide what level of kidney disease you have. The National Kidney Foundation, the American Kidney Fund all have wonderful websites which give us stages of kidney disease. And based on the stages, it gives you a sense of how much impact risk factor management will have in terms of slowing down the progression of kidney disease and preventing worse complications. The major features or treatment modalities are controlling diabetes. We aim to keep people's diabetes control to normal blood sugars and hemoglobin A1Cs that are normal levels, for weight control, even moderate weight loss, 10 to 15 pounds that's sustained over time will have a significant impact on both diabetes and high blood pressure control, and also on preventing progression of kidney disease. Controlling your cholesterol. Your kidneys are made up of a lot of blood vessels, so any disease process that can happen in the large blood vessels, the heart, to the brain, to the legs, the same things can happen in the kidneys as well. In terms of blood pressure, we aim for blood pressures below 130/80. If you're diabetic, we aim for lower, below 120/75. And then in terms of avoiding medications that may hurt the kidneys or impact on the kidney function, such as non-steroidal anti-inflammatory agents. Also, certain antibiotics and other medications may need to be at a lower dose to prevent complications, because to accommodate the fact that your kidneys aren't clipping out the medications.
iCompassion.org, a registered 501c3 nonprofit, is the first free, independent, and trusted online community for people dealing with kidney disease. iCompassion.org allows people to quickly find information regarding kidney disease and treatment options, and to become a part of an online community to get connected, get better, share hope, and give back. Join today and share your story of hope.